Alright, so without further ado, we would like to start off and kick off this event. So Dre, kindly please introduce our very first speaker for this morning.
All right. So, our first speaker for today, he is an epitome of the successful provinciano. He doubled as a crew in a fast food chain during his student days until he finished his nursing course with honors and made his parents proud with his sterling performance in the nurse licensure examination. His story of success represents the aspiration of today's nurses. So today he is co-listed with Bill Gates in the 25th edition of Marquis' Who's Who in the World. He is the first Filipino to write a test preparations guidebook for the world's leading health scientist publisher, Mossby Elsevier, and Jones and Bartlett Publishers, USA. So he has over 25 years of teaching and administrative experience in test preparations, including graduate and undergraduate nursing programs. He was named one of the Go Negocios first 50 inspiring Filipino entrepreneurs and Philippine Graphics Magazine's 2006 Young Leaders of the Philippines. He received the MVP Bossing Award of Education, the Agora Award of Entrepreneurship from the Philippine Marketing Association, the SMEIT Award for Innovation for the Philippine Internet Commerce Society, the 10 Outstanding Filipino Entrepreneur from the Entrepreneur Magazine, and the Young Market Master of Entrepreneurship from Mansmith and Fielders. He is the first Filipino nurse entrepreneur to be accepted as a member of the prestigious Ernst and Young Entrepreneur of the Year Academy. Currently, he serves as a trustee of the Philippine Center of Entrepreneurship. He finished his Bachelor's of Science in Nursing, cum laude, and Master's of Arts in Nursing, summa cum laude, at the University of Santo Tomas. He was a board top-notcher in the Philippine Nurse Licensure Examination, where he obtained a rating of 89.20. He obtained his post-baccalaureate certificate in e-learning design and Master of Education in Learning, Design, and Technology at the Pennsylvania State University, where he finished both courses with a GPA of 4.0. He received his training on online facilitation at the Harvard Graduate School of Education. So everyone, let us all welcome Sir Ray A. Gapus. Hi, Sir Ray. Good morning.
Good morning. So let me start with an inspirational session for everyone. I know this is the time that they are already focusing on what they need to remember for the test. And so let's begin. And this inspirational session is dedicated to everyone. So I just hope you get inspired. This is the moment. This is the day when I send all my doubts and demons on their way. Every endeavor I have made ever is coming into play. It's here and now, today. This is the moment. This is the time when the momentum and the moment are in rhyme. Give me this moment, this precious chance. I'll gather up my past and make some sense at last. This is the moment when all I've done, when all the dreaming, scheming, and screaming become one. This is the day. These sparkle and shine when all I live for becomes mine. Now the time has come to prove to them I've made it on my own. This is the moment, my final test. Destiny beckoned, I never reckoned second best. I won't look down, I must not fall. This is the moment, the sweetest moment of them all. This is the moment, time on earth. This day or never, I'll sit forever with the gods. When I look back, I will always recall, moment for moment, this was the moment, the greatest moment. RN aspirants, this is your moment, and this is the greatest moment of them all. And as we actually sang in the song, you should not be second best. In essence, you have to be the best version of yourself before we engage in our focus for today. And as Oprah Winfrey said, this is your moment, so own it. So everybody type it on our chat box. This is my moment. Come on! Salamat po. Sabi niya, sir, ang galing. Ayan. Yan po ang produkto ni Kuya Vinny Saturno. Who actually trained me and my vocal coach. Okay? Ayan. Ayan po. Yan, this is my moment. Ayan, dami-dami, inoon talaga nila. I know class, colleagues, and RNs to be. This time of the year, I was once in your shoes, no? Parang estudyante. Okay? Nung ako'y parang estudyante, katulad nyo, estudyante pa lang katulad nyo, rather, pag mga ganitong panahon na at magbo-board exam na, ang nangyayari, marami ng mga nakaka-distract. May mga ganitong sabi ni ganito, ito aralin, sabi ni ganito, ano to aralin, sabi ni ganito, ano aralin, sabi ni ganito, 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 ganito. So, ang ending, pinatulan mo lahat. Okay? Hiningi mo yung handout sa classmates mo, hiningi mo yung notes ng classmates mo, and then kinumpile mo siya. Pagkatapos mo siyang ayusin, bigla mong sasabihin sa sarili mo, wow, ang dami ko pang aaralin. Tulog na ako. Okay? So, wala tayong patutunguhan pag gano'n yung mentality natin. Hindi ko naman sinabing kailangan at this point, tapusin na natin lahat at basahin na natin lahat. That is a sure way to fail. Pag ang goal mo ay babasahin mo lahat. So dapat mag-focus ka lang sa kung ano yung pinaka-importante. Remember, this is your moment. So, leave that to us. That is our job. And joining me today definitely is the former chair of the Professional Regulatory Board of Nursing, the Honorable Dr. Glenda Arquiza, who will be sharing with us guidelines on what you need to do for the test so that it would lessen your anxiety. Okay? So, hindi naman maganda na wala kang anxiety pagpunta mo dun sa exam. Hindi maganda yon because mild anxiety makes you alert. But, never ever panic. Because when you panic, personality disorganization occurs and then mental blackout shuts down your perceptual field. So in essence, inherent mechanism ng katawan natin para hindi tayo magkaroon ng personality disintegration. Kaya dapat mild anxiety lang. That would be okay. Okay, now once again, I'm your mentor, your fact check buddy at your service for today's session. And without further ado, let's focus on the concepts every test taker should know before taking the NLE. Now, remember, itong mga bagay na ito ang kailangan lang natin pagtuunan ng pansin. Hindi natin sinasabi na ito lang yung dapat aralin. Ang sinasabi natin, gamitin natin ang Pareto Principle. Sir, ano yung Pareto Principle? Yung ba yung ihanap mo ko ng jowa, Pareto? Pareto Principle means 80-20. Ano ibig sabihin ng 80-20? Sabi ng isang estudyante ko, Sir, 80% papasa, 20% babagsak. O the other way around, 20% daw papasa, baka 80%. Hindi naman. Pareto Principle means, if you focus your attention on the 20% of the concepts that comes out in 80% of the time, you'll become more successful. Okay, ano sinasabi nun? Pag yung attention natin, ibinaling natin dun sa 20% lang na alam natin ay base sa framework, ay itatanong, mas successful tayo in 80% of the time. Yun ang 80-20. Okay? So, wag dapat 100% ang goal mo. 80-20 ka lang. At this point in time, focus on the 20%. 20% that usually comes out on the test based on the framework. Again, ang framework naman ay na-distribute lahat yan sa mga eskwelahan natin. Alam ng ating mga mentors ang framework. Dito, iha-highlight ko lang, then i-apply natin sa sample question para lang maalala mo. Therefore, ang team song mo ngayon, bukod sa this is the moment, ay it's all coming back to me now. Huwag kang magmumoto ng past is past. Ibig sabihin, lahat ng tinuro sa'yo, kinalimutan mo na. Okay. So, anyway, let's begin. Reminder, a copy of the slides for this presentation will be sent to your email after the webinar. As usual, okay, maraming mga nag-register, tapos on the day of the webinar, gusto nila ma-send lang yung materials. Now, that's not how it works. You will most benefit from this session if you attend it, okay, and then eventually use the copy of my slides, which we're going to send you after the webinar, as your guide. Okay, so sit back, relax, wag na munang magsulat ng kung ano-ano, pakinggan ninyo kung ano ang mga bagay na kailangan nating pag-aralan. So, before we begin, let's have an inspiration from the mail. Isa ito sa mga nag-attend nung July session natin, Sir Miko and the Health Carousel team, Ma'am Glenda. Ito sa isang mga inspiring na mga messages na na-receive natin. Yung mga umattend last time na wala silang pang-review, na kinabang sila dito sa sessions, okay? And then eventually, they actually sent a thank you email. So, this came from Christy. Good day, Dr. Ray Gapos. Thank you, sir, sa lahat ng upload nyo sa YouTube. Nang dahil sa upload nyo, sir, marami akong natutunan. Madamo gid ga, salamat, sir. Nakapasa ako nang dahil sa free lecture nyo po. God bless you, sir. Siya na mismo nagsabi niya, hindi galing sa akin, ha? And I said to Christy, thank you for getting in touch, Christy. God bless you and congratulations from Mentor Ray. Ayan. Okay, so let's move on. Tatandaan lang natin, if we believe, we can. Okay? So ito yung sinasabi niya. May I invite everyone to please do subscribe to our YouTube channel, Gapos Mentors, and you will have a choice of videos. At the moment, we are focusing on concepts for the NLE. Okay? So maraming salamat po. Okay? Now, before we get to start, another inspiration, I'd like to congratulate Julius Linsangan de Guzman of Nueva Ecija University of Science and Technology, who now joins our roster of thousands of USRNs, which we have produced around the world. Okay, the Ray Gapos system is present in 25 countries. Now, Julius is now a USRN, and he passed the Northern Mariana Islands Board of Nursing last October 26, 2021. So parang last week lang yan, okay? So congratulations. So 2 weeks ago, Sir Julius, and sana masundan ka pa ng marami sa ating mga participants today. Okay, si Mary Ann naman sent me a very good message. Sabi niya, so God is using you to be a blessing to all nurses. Keep it up, Sir Ray, and all the staff of Ray Gapos. Praying that you will continue to soar high like an eagle and that He will give you more strength to teach nurses to be on top of the NLE. God bless you more, sir. At ito naman ang sabi ko sa kanya, Mary Ann, God has perfect timing. Never early, never late. It takes a little patience and it takes a lot of faith. But it's definitely worth the wait. So always remember, God will give us what we want at the most appropriate time when we can best appreciate it. So wag mawawalan ng loob pagka minsan kinukulang yung ating effort, minsan may mga stumbling blocks along the way. Those are God's way of telling us, not now, it will happen in the best possible time where you can best appreciate it. At bago tayo therefore mag-umpisa, okay, I'd like you to raise your right hand. Come on, everybody. Let's raise our right hand. O yung iba, hindi pa alam kung ano ang left tsaka right. Ano ba yan? May dyslexia ka. Let's raise our right hand and then place it over your chest, okay? On the area, okay? On top of your heart. Come on. And then, let's say to ourselves, in God's perfect time, I surrender with faith. Come on, everybody, let's say it. In God's perfect time, I surrender with faith. Okay, once again, let's say to ourselves, in God's perfect time, I surrender with faith. So it's a recognition, even if we've done our best. Alam nyo, may mga nag-take ng board exam na yung initially, okay, bumabagsak sila. At nagkaroon ako ng 2 estudyanteng ganyan. Yung pangalawang take nila, aba, nasa top notcher. Okay? Lalo yung isa, may estudyante ako from Cebu, initially failure, aba, no, sumunod, number 7. You see, it happens at the most appropriate time when we would be able to best appreciate it. So, laban lang ha, okay? Don't give up. Don't give up on your dream. Okay? That is not just for yourself, but it's also for your family and for the country as a whole. So, let's move on. So what are the concepts that every test taker should know before taking the NLA? Here we go. Let's begin. The top 5 answers. Okay, once again, hindi ko po sinasabi na ito lang ang pag-aaralan nyo. Baka ang gawin mo, dito ka na lang mag-concentrate. Although, sabi natin kanina sa Pareto principle, 80-20. You focus on the 20% of the concepts that comes out 80% of the time, so you'll be able to give the test a good fight. Tatandaan mo, ikaw ang nag-iisip. Yung tanong, static yon. So, mas lamang ka kesa sa tanong. Okay? So, pagka medyo nawawalan ka ng loob, sabihin mo sa test paper mo, hey, tanong ka lang, sasagutin kita. Okay? Although, ang problema doon, kung yung sagot mo ay tama o mali. medyo kailangan pag-isipan ng sagot. Here we go. What is number 5? Okay. So, number 5 on our list is collaboration with the multidisciplinary team. Ngayon, natatawa ako kasi sabi ng isang estudyante, I was discussing like collaborative interventions with a multidisciplinary team. Sabi niya, sir, alam mo, first time ko narinig yung term na multidisciplinary. So ngayon, ano bang kailangan ko pag-aralan dyan, sir? Yung bang collaborative interventions o yung bang multidisciplinary team? First and foremost, let's have an example of a question so that we can contextualize itong number 5, okay, concept na ito. Okay? So let's try answering a sample question. Here we go. The nurse is taking care of a client with difficulty swallowing and left facial drop. Okay? Now, ano nakalagay dito? This is what we call syndromic approach to question, construction, and syndromic approach that requires syndromic approach to analysis. Ano ibig sabihin, sir, ng syndromic? Yung hindi binibigay yung diagnosis. Ikaw ang mag-iisip, ano yung sakit ng pasyente. So here we go. We take this group of symptoms, therefore, difficulty swallowing and left facial drop as indicative of CVA. So pag nakita mo yung sentence na yan, think about CVA, think about stroke, think about embolism, think about cerebral hemorrhage or intracranial hemorrhage, okay? Think about all these things. And then, he has had choking episodes. Ano ibig sabihin nun? Okay? Kumain daw siya sa choking? Okay, nabilaukan. The nurse should refer the client to which member of the multidisciplinary team. Ito na yung sinasabi ko. Then you have several specialists as options. Okay? And some of this, minsan hindi natin naiintindihan ano yung role ng mga yan in terms of providing nursing care. So, in essence, para masagot natin to ng tama, kailangan unang malaman natin what do we mean by multidisciplinary and how it differs from the term interdisciplinary and transdisciplinary. So, let's talk about the models of care. that we provide our patients. So let's begin with multidisciplinary. When you say multidisciplinary, this involves professionals from several disciplines who work independently of each other. So which means the professionals work side by side but separately. So the disadvantage of the multidisciplinary intervention is that it leads to fragmented care. Now, an improvement of the multidisciplinary model is the interdisciplinary model. Now, how is it different? In the interdisciplinary model, we involve the parents of the patient. So we have the parents plus professionals from other disciplines that work together. So as a team, they interact through formal channels. However, how will they work? They work individually in assessing the patient and then later on interact as a group. So individually, then as a group. So that's an improvement from multidisciplinary model. However, there's also an improvement of the interdisciplinary model. So that's what we term transdisciplinary model. Now, how is it similar to interdisciplinary? In transdisciplinary model, the parents are also involved, okay? And then team members accept and accentuate each other's knowledge and strengths to benefit the child and the family, okay? Which means, okay, the benefit of the transdisciplinary model is not just on the patient, it's not just on the parents, it also involves the family. Therefore, the transdisciplinary model facilitates integration, okay, of the principles of coming from the different specialty disciplines, and it facilitates interaction in order to properly manage the patient. In essence, ano yung pinaka-align sa mentality ng Filipinos? Alam mo naman, Filipino, family-oriented yan. So, mas aligned yung transdisciplinary. But the question is not asking about transdisciplinary. It's asking about multidisciplinary. So, paano ba ginagamit ang members ng multidisciplinary team? Take note. Hindi po yan fix ang members. Ano ibig sabihin, sir? So yung members ng multidisciplinary team would depend on the diagnosis of the patient, what the patient needs are, and the sequela of treatment, as well as the complications of the patient. For example, yung pasyente initially nagkaroon ng meningitis. O di kailangan mo ng doktor sa ang specialty ay infectious diseases. Okay. So, yung nag-meningitis, nagkaroon ngayon ng residual. Okay? Ano ibig sabihin? Nagkaroon siya ng motor deficits. O di kailangan mo na ngayon ng neurologist, okay? And at the same time, nagkaroon ng visual impairment. So, kailangan mo na ng ophthalmologist. And then, nagkaroon ng hearing impairment. Di na makarinig. Di kailangan mo na ng audiologist. So, parami ng parami habang dumadami yung complications. Yun ang konsepto ng multidisciplinary team. So, you always base your answer on the diagnosis of the patient as well as the client needs, including the sequela of treatment and potential complications. Therefore, para maintindihan natin, balik tayo dun sa tanong. Let's try answering the sample question. The nurse is taking care of a client with difficulty swallowing and left facial drop. Again, think of CVA. So we need a neurologist. He has had choking episodes. Ayan, nahirapang mag-swallow. Remember that the muscles of articulation, the ones that we use for speaking and the ones that we use for swallowing are one and the same. That's the reason why, neurologically speaking, pag ang pasyente may dysphagia, okay, or may dysarthria, nire-refer sila pareho sa speech-language pathologist. Okay? So the nurse should refer the client to which member of the multidisciplinary team. Ngayon, kailangan ba natin ng neurologist? Yes. We said yes a while back. Speech-language pathologist? Yes. Basta may dysphagia tsaka may dysarthria. Once again, dysarthria means okay, difficulty in articulating oneself. Eh ano daw ba yung articulate? Maarte na makulit pa. Articulation means expression of oneself verbally. So if the patient is having difficulty with articulation, then you need the help of the speech-language pathologist. Here's the rub. Ito mahirap i-analyze dito. Yung isa, registered dietitian, isa nutritionist. Sasabihin mo, are they one and the same? Do they have the same function? Di ba kasi may course na nutrition and dietetics? So isa lang ba yan? Chechikan ko ba yan pareho? Okay. So ang tanong, ano ba yung difference ng dalawa? Okay, when you talk of the multidisciplinary model, the definition says a team of professionals. So, dapat alam mo anong definition. Okay? A registered dietitian is a professional who is engaged in modifying a client's diet in order to prevent a complication and to address, okay, manifestation and to correct a problem in a patient with difficulty of eating, okay, or swallowing. Okay, now, in essence, okay, yun namang nutritionist is any person who knows about food. So if the patient doesn't have a pathological condition, gusto lang niya balanced diet, punta ka sa nutritionist. So walang pathological condition. In essence, okay. So sino ngayon ang dapat membro ng multidisciplinary team? We said a while back, multidisciplinary team involves professional. So who is considered as a professional? The registered dietitian. So we put an X to the nutritionist. Okay, now, gynecologist, hindi natin kailangan ng gynecologist, di naman buntis tong merong CVA. So we put an X. Lalo naman yung podiatrist. The podiatrist is a doctor specializing in foot care. Yung may mga kalyo ang paa, may mga fungal infection ang paa, yung may mga sensory impairment ang paa because of diabetes, you need a podiatrist. That's pronounced podiatrist. So we put an X. Ayan. So therefore, the answers are 1, 2, and 3. So you need the neurologist because the client has CVA. You need the speech language pathologist because the client has difficulty swallowing. You need the registered dietitian because you need to modify the patient's diet kasi nga may choking episodes. Now, did I make myself clear with regard to this specific concept? Kindly type yes or no. Those who will actually type their answers would get a rating of 80 and above for the board exams. Ayan. Okay. Ang dami, katuwa. Okay, yes daw. Okay, great. Now, you will remember us, okay? Alam nyo na kung paano sagutin. Pag ang tanong about multidisciplinary team collaboration. Excellent. So, number 4 na tayo. Okay. So, dito naman sa number 4, okay, ano bang konsepto ang kailangan tandaan? Okay, hindi kayo makakaligtas. Sorry kayo. So, research. Okay, so ano kaya sir ang pag-aaralan ko sa research? Well, okay. Ano ba yung expectations? 'Di ba? Yung learning outcomes ng program natin sa BSN curriculum, 'di ba? Conducts research. Okay? With a research expert. So in essence, dapat at the mentory level yung iyong ability. So wag masyadong pinag-aaralan mo pa yung Solomon's 4 group design, wag na yung mga ganon. Masyadong mataas yung level non for you. Doon lang tayo sa beginning researcher skills. Okay? So importante, alam mo kung ano yung dependent variable or independent variable, which one is the Y, which one is the X, okay? Study descriptive statistics, di ba? Yung ano ang definition, what is the mean, what is the median, what is the mode, when you have the most frequent figure in your table, is that the mean, is that the median, is it the mode? When you have the average of all the scores, what is that? Is it the mean, is it the median, or is it the mode? Okay. And then you can also try to browse your notes on inferential statistics. Like for example, ano ba yung purpose ng chi-square? Ano ba yung purpose ng t-test? Ano ba yung purpose ng ANOVA? Okay. Just the purposes. Hindi naman kailangan alam mo yung detalye ng lahat. Okay? But ito usually kasi yung pagkakamali minsan ng mga nag-aaral. Kasama na ako doon, no? Pag nag-aaral tayo, pumupunta tayo kagad doon sa specific. Okay? Nakakalimutan natin how to cluster or classify researches. So, kung ako ngayon ang mag-aaral, ito lang ang gusto kong i-highlight for you guys. Okay? Importante, pag-aralan nyo yung classification ng research. Katulad nung nasa question na to, which of the following planned studies are considered qualitative researches? So, kung hindi mo na-focus yung definition ng qualitative and how it is different from quantitative research, okay, nagkakaroon ng problema. So, bago ka pumunta sa specific details, go for the general details first, okay? So, let's try to differentiate qualitative from quantitative research. So, hinighlight ko na yung difference. You have quali with the L, quanti with the N. So, qualitative research is concerned with textual data. Anong ibig sabihin ng textual data? Data that you could actually gather through interview that are non-structured, focus group discussion, okay? Or by means of direct observation of behavior, okay? So in essence, your qualitative research is used to gather in-depth understanding of the sample's thoughts, opinions, and trends that comes out of it, okay? In quantitative research, this is concerned with numerical data, Okay, so when you say numerical data, it is used to quantify the problem by means of gathering numerical data that can be transformed into usable statistics. So ang keyword mo pag quantitative, you deal with numbers. Okay, now to make it more simple. Ngayon, hindi ko sinasabi na ganito dapat ang pag-iisip pag gumagawa ng research. Ang sinasabi ko lang for the purpose of taking the board exam. For the purpose of taking the board exam, code. Okay? Your different titles using keywords. So in essence, mas madali ka ngayong maghanap ng tamang option if you have a system of coding. So ano example nito? Kunwari, pag qualitative, ito yung usually code na ginagamit ko as a test taker. So ang keywords, pag nakakita ako ng research title na kunwari, the lived experience of nurses in the ICU during COVID pandemic, o nakita ko yung lived experience, qualitative yon, textual data. Okay? If there are researches that deals with feelings, reactions, anxiety, beliefs, okay? Gathered through observation, okay? Or focus group discussion, about textual data yon. So qualitative research. Ngayon, okay, pag nilagyan yung title na levels of anxiety o may levels na, may numerical value involved na, nagka-cluster na ng high, moderate, or low. So that becomes quantitative. So when you say quantitative research, our keywords would be the words number, levels, okay, measures, degree, loss, or gain. Kasi when you say weight loss, weight gain, it involves numbers. Okay, now, ngayon na may bala na tayo because a functional concept has given us a sense of direction. Therefore, let's go back to the sample question and let's answer it. Which of the following planned studies are considered qualitative researches? Levels of weight fluctuations among anorexic. The keywords, levels. So this is quantitative kasi weight fluctuations, number yan. So we put an X. Effects of music on feelings. We're dealing with feelings. So qualitative yan, yes. Okay. How stress affects people's behavior. You're dealing with behavior. So qualitative yan. Okay. Effects of regular nurse visits on the number of client calls to the nurse. Number. Okay, so that's quantitative. The relationship between electoral results, okay, and consumer confidence. Ayan, nag-uumpisa na ang election fever sa ating bansa. So whatever your choice is, vote for those who can best serve the country, not somebody else's just personal interest. Okay, therefore, okay, ito, electoral results, number. So quanti yan. So we put an X. So the correct answers are 2 and 3. Now, this could be an oversimplistic method of classifying quali and quanti research, but it serves the purpose. Kasi pagdating sa board exam, wala kang oras na i-recall yung definition. So, kailangan i-code mo lang yung iyong guideline. So, naintindihan po ba natin ang konsepto ng quali and quanti and how to classify and differentiate one from the other? Yes or no? Yes, okay. Now, importante din na pag nag-aaral kayo ng research, okay, alam nyo din yung mga definition of terms ng, yung mga characteristics ng tool like reliability, di ba? Or validity. And you have to know which of the two is the most crucial criteria, which definitely is your validity. Okay, validity means appropriateness of the tool, which means the tool is measuring what it supports, what it's supposed to measure. And when you say reliability, okay, it is the characteristic of the tool that enables it to come up with results or values that are consistent with the condition. So when you refer to consistency or accuracy, that's reliability. When you refer to appropriateness, then that's validity. Okay? So yung mga ganong klase lang ng dapat. Okay? Huwag nyo nang pinag-aaralan nga, yung sinasabi ko na Solomon's 4 group design, yung mga kinukonsume yung sarili nyo, hindi nyo maintindihan. Sa klase ko, tinatanong, sir, paano ba yun? Sinimplify ko na, sabi ng isang estudyante. Sir, hindi ko pa rin maintindihan. Sabi ko, hindi mo maintindihan, tantanan mo na. Tantanan mo na kung hindi mo na maintindihan. Okay? So we're done with 2. Okay, our third focus would be, ayan. Okay, documentation. Now, this is one of our important functions as nurses, di ba? Oh, tawag natin diyan, di ba? Charting. Oh, nung kami estudyante, ang tawag namin diyan, ayan yung paglalagay ng scene awake. So, nung time namin kasi, narrative pa, okay? Yung aming yung aming documentation. So ang tanong mo sa kaklase mo, oy, tapos ka na mag-sin awake. Bakit? Kasi ang first phrase lagi, sin awake, lying on bed with D5 IV fluid, ek. Tapos pag wala nang mailagay, titignan ngayon yung entry sa chart ng isang araw, kinopya yung isang sentence, kinopya isang sentence yung isang araw, pinagtagpi-tagpi. Tapos, ipapacheck na sa CI, oy, umamin tayo. Naalala ko tuloy yung pinsan kong doktor, sabi niya sa akin, oy Ray, tura mo ng maayos sa mga estudyante. Sabi ko, bakit? Sabi niya, biro mo, nag-charting. Sabi niya, nakita daw kasi ng estudyante yung pasyente, post-op. Ang nilagay niya sa charting, dressing, dry and intact. Sabi ng pinsan ko. Alam mo ba kung ano, pinsan, yung operasyon ng pasyente ko, ano, tonsillectomy. Paano niya nasabing dressing, dry and intact, tonsillectomy? Tawa kami ng tawa magpinsan. Yan ang sinasabi ko. Minsan, ginagawa lang kasing automatic. Ang babaw peripheral readers, nakita lang na ang nakalagay. Okay? Ay ano, post-op. Di syempre, characteristic of dressing, dry and intact daw. Ibig sabihin, nag-document siya nang hindi niya nakikita ano yung kondisyon ng pasyente. Bakit ka maglalagay ng dressing, dry and intact? Tonsillectomy nga ang procedure na ginawa sa pasyente. Okay? So here are the functional concepts to guide us related to this topic. When error occurs in documentation, draw a line across the entry and write the word error in capital letters. And on the line, write your name, title, and date. Dito nalilito pag ginawa ng option to sa board exam. Okay? Sir, kasi, ano ba yung tama doon? Yung ang nakalagay may pangalan, tapos RN, o kaya may pangalan, tapos ang nakalagay nurse, tapos buo ang pangalan, walang first name, pero apelyido lang. Sir, ano ang tama? Okay, so let me tell you. Ideally, dapat buo ang pangalan. And then my title. The title could be RN or nurse. And then you have the date. Okay, now, which of your two names would be the most important na dapat buo. Okay? Kung wala sa option na buo yung first and last name, pwedeng initial lang yung name, yung first name, pero dapat buo ang family name or ang last name. So you could write J. De La Cruz Nurse. That is correct. But mas correct pag J. De La Cruz RN. Mas correct yon. Pero pinaka-correct ang Juan de la Cruz RN plus the date. Okay? So pag walang Juan de la Cruz RN, pwedeng J de la Cruz RN. Pag wala yon, pwedeng J de la Cruz Nurse. The most important component of your name would be your last name. O, Tagalogin natin. Ano daw yung last name? Sabi ng isa, yung junior ba yun, sir? Yung last name, yung apelyido. Okay, let's move on. Okay. Now, what about for late entries? Now, when you are documenting in late entries, lalagay mo lang late entry. Ito ang mahirap sa atin kasi paper-based pa rin documentation natin eh. Nung napunta ako sa Amerika, namangha ako sa documentation nila. Kaya nga sabi ko, dito sa Amerika, kahit na, bawal ko lang kasing ipakita yung picture ng screenshot ko nung kanilang system eh. Okay? Bawal. For my eyes only lang daw. Okay? So, ang maganda kasi sa Amerika, yung kanilang documentation, automated na. So, if the patient comes in with edema, i-click mo yung edema. Lalabas yung options doon. Ano ba yung edema? Generalized, pedal edema, periorbital edema. Okay, click ka lang doon. Tapos susunod doon, in addition to edema, what else? Lalabas uli yung ibang symptoms. Tapos pag naklikan mo lahat yung symptoms ng pasyente, automatic lumalabas yung priority nursing diagnosis based on the level of evidence. Wow! Based on the level of evidence. So may priority nursing diagnosis na. So click ka lang ng click. So importante therefore sa documentation ay you know what to look for and you document it objectively and properly. Okay? So let's move on. In documentation, avoid abbreviations and symbols that can be misinterpreted. Okay, let's go over some of this. At dapat ito iwasan. Wag itong gagamitin pag nag-chart. Okay, the number one cause of medication error in a study done in the States is using MSO4 for morphine sulfate or MgSO4 for magnesium sulfate. Okay? Okay, listen class. Okay? So you don't write MSO4 for morphine sulfate because it could be misinterpreted as magnesium sulfate. So you have to write it in full, morphine sulfate or magnesium sulfate. Okay. Another misinterpreted abbreviation, which is error prone, would be your AZT. That's your sidovudine or azithromycin. Okay, kaya nga AZT yan, azithromycin. It's a drug that's given to pregnant patients who are HIV positive to prevent the transmission of the virus to the unborn child. Yan ang AZT. It could be misinterpreted as azithromycin kasi may AZT din to eh. Azithromycin, which is an antibiotic. It's one of the initial drugs given in COVID patients. Okay? SQ, which could mean subcutaneous, could be misinterpreted as every 5 hours. Bakit? Yung S, nami-misinterpret na 5 pag sinulat. Then yung Q, akala every. So you don't write SQ or SC or SUC. You have to write it as a whole, subcutaneous. And then Q1D, which means daily, could also be misinterpreted as QID, 4 times a day. And this could lead to overdose. Okay? And then meron ka ng per os. Okay? So pag sinabi mong per os, minsan hindi napapansin ng iba yung per, which means orally, di ba? Or through the mouth. So nagiging, ang nakikita lang nila OS, oculosinister, which means left eye. So minsan, nami-misinterpret yung per os as pertaining to the left eye. Okay? So, iwasan ang mga ito. Okay? Now, it's only the RN who can accept and transcribe verbal or telephone orders. And chemotherapeutic agents should never be given, orders for chemotherapeutic agents should never be given through the phone. Okay? Now, in documenting a verbal order, write verbal order and then affix your signature and your surname in capital letters. Once again, the surname is the most important. It has to be in capital letters. So, isusulat mo verbal order. Minsan nilalagay telephone order. Minsan nilalagay T period O period, which means telephone order. Okay? So, the RN should transcribe verbal telephone orders with the following details: date and time of order, generic and brand name of the drug, the dosage, quantity and duration, route of administration, frequency of administration, age and weight of the patient, known allergies. Ibig sabihin may allergy, mayaman yan. Kasi pag mahirap yan at may allergy, ang tawag nila doon galis. Reason for PRN orders, and definitely your specific indications, including specific instructions. So it's very, very important that you are focusing on these 10 specific details when you're transcribing verbal orders, okay? So when transcribing verbal or telephone orders, include the patient's name and one other identifier. So pag sinabing identifier, use the patient's birth date. Sometimes they don't remember their medical number or their SSS number. So ang pinaka-useful ay birthday para ka nagbe-verify ng credit card. And take note, class, the most objective way of checking the patient's identity is to check on the armband. Kasi if you ask them their name, some patients with Alzheimer's could actually forget their real name and make up stories because they confabulate. Okay? So what is important, therefore, is that you verify and validate the patient's name and then use an extra identifier, which in this case, ang pinaka-common would be the patient's birthday. Okay? Now, use and document completion of read back. Okay, when transcribing a verbal or telephone order. So, after mo maisulat yung telephone order, basahin mo uli dun sa prescriber. And then after that, in the documentation, write there the phrase, read back completed, and then sign your name. Okay? So, read back ensures that the specific details of the order are verified. Okay? So a verbal order is authenticated by the prescriber by initialing and dating the transcribed order at the earliest opportunity but not more than 72 hours. Okay. So paano sir pag may lumabas sa exam? Kailan dapat daw isignaturean yung verbal order? Diba? The best answer, based on our functional concept, the earliest opportunity. But it should not be not more than 72 hours. Now, kung ang question is about according to Joint Commission standards, meron ka ng Joint Commission standards na phrase doon. So, ano ba sinasabi ng Joint Commission? Sinasabi ng Joint Commission, ideally, verbal orders are signed and dated and timed within 48 hours. So yun ay sasagot mo, within 48 hours. Pero may exception to the rule. Verbal orders on medications and the use of restraints are signed, dated, and timed within 24 hours. So, pag hindi medication, pag hindi use of restraints, sign it within 48 hours. Pero, pag tungkol sa gamot or tungkol sa restraint, have the verbal orders signed within 24 hours. And it should never exceed 72 hours. O, klaro tayo doon. Okay, now, documentation for orders should be, ang code natin dito, TICOL. Ano ba yan? Ano bang code yan? No, TICOL. Okay, should be, okay, timely. So, you have to document immediately after you perform the intervention so you don't forget it. Clear, okay? Huwag kayong gumamit ng hindi standardized na abbreviation. Concise, huwag pahabain. Okay, hindi yan parang sagot mo sa essay question na kulang nala ilagay mo yung lyrics ng Lupang Hinirang sa gitna. Okay? It should be concise, organized, and legible. Ibig sabihin, dapat ang sulat mo hindi kinalukay ng kamay ng manok. So, it must be re-evaluated depending on the patient's condition. Okay. So, this process, therefore, is progressive. Hindi yan one time na ginawa. Dapat, dinodocument mo according to how the patient progresses. Okay. Now, when you document, make sure that you document completely. Complete the details, wag bitinin. So, document objectively. Do not use labels. You don't say the patient is hallucinating because what might look like hallucination to you may not necessarily look like as hallucination to another nurse. So, better yet, you quote the patient. If the patient's document the patient's statements by saying, the patient says, I'm hearing voices. But, ilagay mo yung observation mo. Okay? There are no other sounds in the room except the patients and the nurses' statements or the patients and the nurses' conversation. So which means it's up for the person who will read it to objectively conclude that that could mean that the patient is having auditory hallucinations. Okay? And then you document promptly. Again, immediately after gawin yung intervention, pag may untoward reaction, document it. Okay? Then extensively and accurately. So, let's put into action what we just learned. So let's try answering this. Which of the following chart entries are correct? Okay. The patient is hallucinating. This is a label, so we put an X. The intravenous insertion site is edematous and warm. These are very, very descriptive, and so this is correct. Okay. Bloody vomitious of approximately 100 ml. Once again, this is correct. Okay. Administer heparin SQ. What did we say? This could be misinterpreted as every 5 hours. So once again, we put an X. And then BGB tolerated the feedings. Now, BGB, ginagamit ito usually dun sa UB ward pag may mga twin babies, like baby girl A, baby girl B. So it's not even the proper way of labeling babies. Dapat pag twin yung babies, apelyido ng parents or ng nanay. Kunwari, okay, De La Cruz, okay, baby De La Cruz, girl A. Or baby De La Cruz, boy A. Hindi, isusulat mo yun in full. Hindi pwede na BGB tolerated the feeding. So, again, that's not standard. So, we put an X. Okay. So, I hope you were able to at least gain some insights on how to deal with questions pertaining to documentation come your NLE day. That's your moment. Okay. Now, we're done with 3 out of the 5 concepts that I'm covering for this session. So, what's concept number 2? Ayan. Okay, leadership and management. Sir, nabuboring ako dyan. Same here. Okay. Kasi this is best practice rather than lectured. Although, I usually, okay, pag-usapan natin, anong kailangan mo pag-aralan yan? Definitely, yung difference ng leadership at saka ng management. So when you say leadership, it's about, ayan yung answer ni Janine Togonon sa Miss Universe, inspiring and influencing people. Ayan, okay? To agree, okay? To work towards a vision. Yan ang leadership. Inspiring and influencing. Yung management, primarily this is about ensuring that day-to-day activities, okay, are properly accomplished. In essence, primarily this is about controlling the movement of people so that you can achieve your goals. Okay. So, what is common, therefore, between leadership and management? Definitely, in both, okay, you need control and power. So what sets leadership? Ano ba yan? Lumalabas yung pagka-Ilocano ko, yung dila ko natatapilok. So what sets leadership, okay, apart from management? Okay? So it's about the focus on influencing and inspiring. Okay? So doon siya na naiiba in terms of management. Doon sa management, nagawa niyo yung trabaho niyo, tapos. Doon sa leadership, you go beyond that. Kailangan ma-inspire mo yung kasama mo para ganado siyang magtrabaho. Okay? Now, another thing that I'd like to highlight when it comes to leadership and management concepts would be yung 4 basic types of leadership. At kailan siya gagamitin? Kunwari, during this time of pandemic, na nangangailangan tayo kaagad ng mga supplies. So, we are in an emergency situation. Basta nakita mo yung keyword na emergency, you need an autocratic type of leader. So, which means there's centrality of decision-making sa isang tao lang. Centralized yung power para mabilis. Like, if a person needs Heimlich maneuver or abdominal thrust maneuver, or if a person needs CPR, what type of leadership is needed? Autocratic yon. So, kailangan may isa nagsasabi, ito gawin natin. Okay? So, start na tayo kagad ng compression. Okay? Autocratic. Para sunod-sunod. Kaya na ngayon, pandemic, we need an autocratic type of leadership. Now, to differentiate that from democratic, pag sinabing democratic, participative yan. Kaya nga minsan nagiging democracy. Okay? Democracy. A government by the people, for the people. Sabi ng isa, ano daw yun sa Tagalog? Anong demokrasya, ang gobyerno ay by the people, binibili ang tao. For the people, naghihirap ang tao. Okay, of course. Hindi naman maganda yung translation niya. No? A government by the people, for the people. Okay, joke lang po yun. Ang gobyerno binibili ang tao by the people, for the people. Naghihirap ang tao. Okay, now, ang disadvantage kasi pag democratic, participative, maraming decision makers. So which means, di ba, yung decision making, dinadaan pa sa padamihan ng boto. So nagtatagal, alangan naman na kailangan na ng CPR, magbubutuhan pa kayo dun sa ward ninyo. Oh, ilan ang gustong mag-perform na CPR? So it doesn't make sense, di ba? Okay. Now, if the leadership is buntot mo, hila mo, do as you please, that's laissez-faire, di ba? Kanya-kanya kayo ng galaw. Okay. Now, this is the kind of leadership and management skill that I employ with my team. I do paternalistic leadership or paternalistic management. Sir, paano yun? There's only one person who acts as a patriarch or a matriarch, kung babae, matriarch. Okay? So, anong ginagawa nun? You treat each member of your team as part of your family. Pag nasa opisina kami, we go beyond yung, pumasok ka ba, no? O how do you feel today? May fever ka ba? Okay, we go to that. Sabay-sabay kayong kumain kung pwede. Okay? You check them out on their weekdays. You give them health breaks. Okay? They need to feel the sense of value. Okay? Pag umalis ka, kahit pulburon man lang, may pasalubong. Okay? They perceive themselves as part of their family. Ayan. Yan yung ginagawa ko, ha. Pero hindi ko sinasabing ganon. Example lang yon for you to remember. Okay? So, therefore, let's take a look at an example of a question that deals with leadership and management skills. Okay. One of the most poorly understood concept, kahit ako, nung ako'y nag-aaral pa, would be the healthcare quality measures. Yung tatlo, structure, process, and outcome standards. This is according to the model of Avis Donabedian. Okay? Sasabihin ng iba, sir, ano ba yung structure? Ano ba yung process? Ano ba yung outcome? Simplify natin. When you say structure standards, these are the factors that affect the context of care. So in essence, it measures the quality of care. So anong kasama sa structure standards? So physical structure, kasama yung equipment, physical facility, human resources, okay? Yung mga staff nurses sa kailangan, yan, kasama yun sa structure. Physical accessibility, napupuntahan ba ng pasyente, kasama yun sa structure. Time access to facilities, okay. Yung haba ng pila, gaano katagal ang pila pag nagpabakuna, kasama yun sa structure standard. Time access, okay, gaano kahaba yung pila, kasama sa structure standard, huwag kakalimutan. Staff training, kasama sa structure standard. And then, payment method. Paano magbabayad yung pasyente? kasama sa structure standard. Pero let me differentiate that from the cost of services. Paano ka magbabayad? Structure standard yon. Magkano ang babayaran mo? Process standard yon. Okay? So when you say process standards, is the sum of all factors that make up healthcare. So it answers the question, how is care delivered? In essence, para madali para sa'yo, think about the nursing process. Anything about the nursing process is about process standards. Look, nursing diagnosis, nursing process yan, patient education, interpersonal process, hours of care, follow-up visits. Oh, di ba? Nursing process yan. So process standards yan. Comprehensiveness of care. Ito, tatanda mo, ang cost of services, kung magkano ang babayaran kasama sa process standards. Paano ka magbabayad? Payment method, structure standard. Okay? Communication between the nurse and the patient, part of the process standards. And then, the result of your nursing care of the process standards would be your outcome. So, your outcome is measured against the effects of healthcare on the patient. It is the most important indicator of quality. So therefore, outcomes would always be the primary goal of healthcare. So to make it simple, when you say outcome, it is the response or the result to treatment. Okay, so may diarrhea ka, uminom ka ng diatabs, di ba? O nawala yung diarrhea, yun yung outcome. May lagnat ka, okay? Uminom ka ng paracetamol, okay? Binigyan ka ng health teaching ni John Lloyd, sabi sa'yo, ingat. Process standards yon. Okay? Kasi may health teaching di ba? O, ngayon, nung nawala yung lagnat mo, yun yung outcome standards. Okay? Okay. So, yung tagal mo pumila sa parmasya para bumili ng biogesic. Okay? Yan, time access to facilities, structure standard yon. Okay. Class, naiintindihan nyo ba? O gusto nyo pang i-simplify ko pa ng mas simple pa doon? Okay? Try natin kayanin. So, please do tell me, are you learning so far? Yes? Excellent. Okay. So, let's move on. So, let's try answering a sample question. Ngayon na may bala na tayo, may functional concept na tayo, i-apply natin yan. Okay? Apply natin sa isang example. Okay? Which of the following reflects process standards? Ano sabi ko kanina? Pag process standards, think about nursing process. Hospital bill. O, di ba cost of service yan? Yes. Okay. Post of follow-up. O, di ba? Part to ng nursing care. So, put a check. Nurse-patient interaction. Sabi natin kanina, communication between the nurse and the patient. So, process standard yan. Food care services to diabetic patients. Process standards yan. Relief from constipation. Ayan, relief. So, that's the result. So, that's the outcome standard. And tinatanong process. So, we put a next. Okay. So, that's simple and fun. Okay. So, we're now down to our last focus for this presentation. And we're talking about, okay, ano pa nga ba? Okay, edi yung anak ng pato. Ano yun, sir? Ethical, legal, and moral principles. Na wag nyo naman kakalimutan yan. Yung itik, anak ng pato. Okay? Okay, let's have an example. Okay, but before that, let's run through some of the ethical principles that are commonly misunderstood. So let's begin with veracity. It means truth-telling. So for example, if a patient is terminally ill and the patient asks you, am I dying? So your response should be based on the principle of veracity. So tell the truth. So what will you say? If the patient asks you, am I dying? Alam, sabihin mo, oo. Even if you know, it's always important that you have to acknowledge hanggang saan lang ang role mo as a nurse. It's about caring. So you tell the patient, would you want to discuss that with your physician? I can call him up now so you can talk. Ganon kadapat ka therapeutic. Next, autonomy means freedom of choice, self-determination, and privacy. Whether a person wants to be circumcised or whether a person wants to use contraceptives, it's all up to themselves. It's their choice. Katawan nila yon. So that's self-determination. Okay? Next, beneficence, an act of kindness. Do something good. So when you go out of the way, of your way to do an act of kindness, that's beneficence. So simply put, that's your duty to promote the well-being of others. Gawin mo yung nakakabuti para sa iba. Then you have non-maleficence. Do no harm. Like for example, when you choose the proper size of the catheter para hindi masyado masaktan yung patient, then that's a manifestation of non-maleficence. Okay? And then justice means fairness. Okay? Everyone is given an equal opportunity, an equal chance. Ayan. And definitely, paternalism, which means making decisions in the patient's best interest. Now, sometimes, class, listen to this. Paternalism could lead to ethical dilemma. Sir, bakit? Kasi it runs counter to autonomy. Sabi kasi ng autonomy, hayaan mo yung pasyente ang magdesisyon sa sarili niya. Sabi naman ng paternalism, you can act as a parent, decide based on what is best for the patient. Now, kailan natin pwedeng gamitin ng paternalism? Pag yung pasyente unconscious at wala ng ibang relatives who could give the consent. Okay? So the doctor has to exercise medical discretion based on the principle of paternalism, decide what is in the best interest of the patient. Kung makakabuti sa pasyente, wala nang means na makakuha ng consent, so gawin mo. That's based on the principle of paternalism. Okay, now, let's try answering a sample question. Which of the following scenarios are appropriately reflective of the ethical principles identified? Now, ang maganda dito, ang tinatanong sa'yo, kung yun bang scenario is descriptive doon sa in-identify na ethical principles. Let's go through it and analyze it. Justice, administering immunization to infants. No, justice means fairness. Administering immunization to infants, that's to promote well-being of the infant. That's beneficent. So it's not a match. Put a next. Veracity means truth-telling. Answering a client's question with the right facts. Yes, that's honesty. So that's a right match. We put a check. Non-maleficence means do no harm. Choosing the right size of the catheter so you lessen the harm. Yes, that's a match. Paternalism, acting like the client's parent. Yes, okay, we put a check. And then last but not the least, beneficence, providing a back rub to a client. So that is an act of kindness. Yes, we put a check. Okay. Sabi ni Cherry May Garcia, ngayon ko lang talaga to naintindihan. Thank you, sir. Maraming salamat, Cherry. Ngayon mo lang naintindihan, magbo-board exam na in 2 weeks. Ano ka ba? Okay. Thank you. I'm trying my best to make it as simple and as chewable as it can be. So that na maalala nyo kami. Thank you, sir. Ngayon ko lang din sabi din ni Pamela. May second demotion pa tayo. Nagsabi si Cherry, nag-second demotion si Pamela. O, ayan na. So, maybe you guys represent, okay, a lot of those who really would want to understand these concepts properly. Idol ko talaga kayo, sir. O, sige, I can train you to become another Ray Gapos in the future so that you can continue doing functional concepts. Okay. Simple explanation, easy to understand. Salamat. Mahirap po kasi talaga yan, sir, kapag di naintindihan. Correct. At mas mahirap kapag hindi rin naintindihan no nag-i-explain. Pareho na kayo hindi nakakaintindi. Okay. So, thank you. Madali intindihin. Okay. Kapag discussion. Okay. Okay. Yung teacher ko, sabi niya, yung teacher ko po, naintindihan mo sa akin, salamat. Okay, thank you. Now, kaya humihirap kasi sa board exam, kasi nga, anxious na kayo. Hindi dahil sa hindi mo naintindihan, no? Patawarin mo yung sa sarili mo. Anxiety sometimes limits our cognitive abilities. So, hindi dahil nabobobo ka. No. Patawarin mo ang sarili mo for that. Hindi ka nag-iisang gano'n ang pakiramdam. Okay? Okay, forgive yourself. Okay, and remember this. Okay? Strategize, do not memorize. Sabi niya, sir, sa dami ng binasa ko, parang lutang na ako. Huwag ka nang magbasa. Just focus on the pointers. Okay? Do strategize, do not memorize. Reflect on what you read. Do not memorize what you read. And always put this in your heart. Success is won by those who believe in winning and then prepare for that moment. Class, remember, this is your moment. Diba? Sabi nga natin sa kanta kanina, damn all the odds, this day or never, I'll sit forever with the gods. Oh, diba? Damn all the odds. Okay? So this is your moment. Grab it. Okay? Own it. Maniwala ka sa sarili mo. That's the most important thing. And always think that, yes, you can. If you think, you will. Okay, this is your moment. So thank you so much with your questions. I'll entertain them after the presentation of our ever dearest mother of nursing, the former chair of the Professional Regulatory Board of Nursing, Dr. Glenda Arquiza, will be coming in, okay, after the brief introduction with our from our host. So thank you and see you back in the Q&A portion. Maraming salamat. Okay. Do not underestimate the heart of a champion, sabi ni John Aaron. That's true, John. Okay, thank you, Sir Miko. Okay, back to you.
Thank you very much, Sir Ray, of course, for enlightening and providing a lot of knowledge and information, di ba? Guide kung paano natin or kung paano pa mas mapapabuti yung pag-take nyo ng nursing licensure examination. And I'm sure that a lot of you are combination ng excited, pati anxious to take it. But for now, let's take away that anxiety and let's enjoy muna a bit. For around 10 to 15 minutes, we will be announcing our early bird winners. And of course, we will be having a very, very short game before we proceed to our next speaker. So, for our early bird winners, you each